The order of the abdominal assessment is a bit different than the other orders, as we want to listen before we touch the abdomen. As with the other body systems, we begin with inspection. While the patient is lying flat, drape the body to expose the abdomen. With the hands at their sides and their knees bent to soften the abdomen muscles, observe the shape. Note if it is flat, distended, or obese. Notice any obvious masses, protrusions, or scars. After inspection, auscultate the abdomen in 4 quadrants, listening if bowel sounds are present. The presence or absence of bowel sounds is most useful in the context of the patient's clinical situation.